Migraines can be very debilitating and can interfere with anybody's life. But Dr. Shevel of the Headache Clinic has got a solution for you. We caught up with him, and this is what he told us. Migraines are experienced by an estimated billion people worldwide who live with the burden of pain and suffering for the most part of their lives. This is due to underdiagnosis and treatments that are generally not effective. But in South Africa, pioneering work is being done to find solutions to this debilitating condition. The team provides non-drug, permanent treatment to restore the quality of life for headache sufferers from all over the world. And this team is led by Dr. Elliot Shevel, South Africa's pioneering migraine surgeon and medical director and founder of the Headache Clinic. Doctor, pleasure to catch up with you.
Thank you very much for having me on your show.
And I'm pleased that I'm having this conversation with you. I'm not suffering from a headache at this time.
I'm delighted.
So, in the event I was living with the problem of migraine, what would I be going through now, and what would you be proposing or suggesting I do at this time?
Well, you know, most times when people go to their doctor or headache specialist with a headache, the doctor sits opposite the desk from them and he listens to the story and says, what kind of pain have you got, where's the pain, etc. And then he writes a prescription and he says, try this.
Yes.
Without diagnosing properly where the pain is coming from.
Yes.
So what is different about the Headache Clinic is we find out exactly where the pain is coming from. It's never coming from the brain. In migraine, it's always from the outside, from the muscles of the jaws or neck, or the arteries, the blood vessels in the scalp. Those are the two main things. And it's different in different people.
But you know, but the sufferer, people who live with migraines will tell you that the pain is unbearable.
It is.
And that it comes at any given time, and they cry out for help. They've tried all sorts of things, and there's not useful help that they find out there. But you know, the way you explain it to me, you simplify it, it sounds like, well, it's not
well,
really...
it is, you know, the principle is simple, but it's taken me 20-odd years to get to this stage of constant study and hard work. But now we're able to help most people. I mean, look, you know, we're not magicians. We can't help everybody.
Yes.
But most people with migraines, headaches, cluster headaches, which are even worse than migraines, most people we can help.
Okay, just take me step by step how you made the discoveries that led to you establishing the Headache Clinic, and then we'll go through the diagnosis and the treatments, all the solutions that you propose.
Okay, well,
I know you've been around for quite a while. I've paid you a visit a couple of times, Doc. But I think it was not migraines. It was just maybe, regular headaches that would not go away. But now I'm happy to tell you that I'm good.
Good. Okay, I'll cut this long story short.
Yes.
My job, actually, I'm what's called a maxillofacial and oral surgeon.
Yes.
And we deal with pain of the face and side of the head, around this joint. And in 1992, I devised an appliance that you wear in the palate to treat this pain. And it works very well, but some of my patients came and said, my migraine is better. So, you know, fools rush in where angels fear to tread. Yeah. I thought I had the whole answer to headaches and migraines.
Yes.
So I opened the Headache Clinic. A few years later, I found out that certain people, the pain comes from the arteries in the scalp, not inside the brain.
Yes.
And being that's my line, the surgery of this area, I started closing off the arteries that were causing the problem. And in people with arterial problems, when you close those arteries, that is it forever. They don't get pain again. Of course, the first thing people ask is, but if you're closing the blood vessel, what happens to that blood?
Yeah.
Fortunately, we don't need these particular vessels. They're like the tonsils and the appendix and the wisdom teeth. We can close them off, you don't need them. So that's really the basis. But there are a lot of other things that can contribute, like stress, certain dietary triggers, even the painkillers that people take for the headaches can make them worse.
I've heard and I've seen people who live with this condition of migraines, and not being able to cope because they say they can never predict the onset of the pain, and when it occurs, it disempowers them, it disorients them completely, and they suffer for extended periods of time.
Absolutely. I think recently there were some statistics coming out of the States. About 25% of migraine sufferers have lost their jobs because of their headaches. A large proportion, I don't remember the exact amount, have been divorced because of their migraines. And the migraines affect their relationships with their children. They can't look after the kids. It affects their relationships with everybody. They can't go out because they're scared they're going to get an attack when they go out. And it's something people can't see. They're just complaining of it, and people are very often not sympathetic because they can't see anything wrong.
Yes. And with the unpredictability of the onset, I suppose, is the problem. Yeah.
Absolutely.
So now, the way you explain it, you make it sound, well, let me say simple.
It's logical.
Yeah.
Put it that way. We approach it logically.
Yes.
And in most people, we can find the cause. And once we found the cause, in most people, we can treat it.
So, in your consulting rooms, what is the evidence? I mean, people suffer from migraines. What would the onset, what would the cause of that be in the main?
In the main, the pain comes from two places. One is, as I said, the muscles of the jaws and the neck, and the other's from the arteries in the scalp. But now, when you say what causes it, people and doctors get mixed up. They don't understand the difference between what triggers it off and the underlying cause. Let me explain triggers. Some women, just before the menstrual cycle, they get headaches, or during, so they reckon that the hormones are causing their headaches. Somebody else will have some alcohol and he'll get a migraine. Somebody else will have cheese or chocolate. So there are all these different triggers.
Yes.
But those are not causing the headache. They're triggering off something that's wrong. And the best way I can explain it is if you put a landmine under the ground and you prime the detonator, anything standing on that landmine is a trigger to trigger it off.
Yes.
If you take the detonator out, an elephant can stand on it, it will not trigger off. So we don't look at the triggers. We try and find the patient's detonator and remove it.
Yes.
And then the triggers don't work anymore.
I see. And now, given that you've isolated those particular two places where it's likely to be felt, you said it's outside. So what then do you recommend? What happens to the patients?
Well, first, look, every headache sufferer, there can always be a brain tumor or an infection or something. So every patient that comes into the headache clinic, the first person they see is our neurologist, who does a proper neurological examination to make sure that they haven't got some life-threatening problem or infection that in the brain. If they do, and it happens very seldom, we then refer them to the appropriate person.
Because that can be the case too.
That can be life-threatening, yes.
Yeah.
But once he gives them a clear bill of health, and we know the brain is okay, then we know the pain is on the outside. And our staff, we've got highly trained nurses who've been trained in my methods, and they know exactly where to find the pain and how to get, if people come in with pain, we've developed ways of getting rid of their pain very quickly and easily. And then the main thrust, though, is to prevent the pain ever from happening.
Yes.
So we treat the muscle pain. There are a number of ways of treating it. The one is that appliance that we use in the mouth. If it doesn't work, and it doesn't work for everybody, there are trigger points in the muscles that we can neutralize with heat.
Yes.
We use Botox, you know what they use for cosmetic purposes? Botox paralyzes a muscle. So if there's an area of the muscle that is in spasm and you Botox it, it relaxes. The only problem, it only lasts a few months.
Yes.
You've got to have it again. And we use physiotherapy. And so there are a number of treatments we use for the muscles.
And people travel from around the world coming to see you and your colleagues?
We had somebody landed yesterday from Israel. Last month, we had one person from England. We had a person from Australia. I've had somebody come from Turkmenistan, Vladivostok, all over the show.
Yeah, and because of the this unbearable pain that people live with.
These treatments are not available anywhere else in the world. We're trying to spread the knowledge,
yes,
but it's very difficult to get people to understand new treatments when they're used to old things.
Now, those who live with migraines and suffer from them will understand what we're talking about. But for many of us, we may not understand, and maybe that's why we're not even sympathetic, because you see, they can't see it.
Yeah, they say, get a hold of yourself,
yes,
pull yourself together,
that's
relax.
Right. So, but, I mean, how do you explain the difference between migraine and just your ordinary headaches to a person like myself?
The main difference,
yes,
to be quite honest, it's the severity. As the headache gets more severe, you start getting the symptoms that people have that they associate with migraine: nausea and vomiting, light sensitivity, sound sensitivity. As the pain gets worse, they get more of those symptoms. But it's really, the conditions, all of them are caused by muscle and arterial pain.
Basically, what we call headache, that's it.
Now, the interesting thing for the listeners is that this artery operation that I discovered back in 1995, when I went into the history, I found that there was a French surgeon in the 1500s. He cut his own artery for his own headaches. I looked further back. There was a Moorish surgeon in Spain 1,000 years ago who described the operation. I thought I was the first.
Yes.
But wait for it. There are certain ethnic groups in this country and in other parts of sub-Saharan Africa who also cut that artery.
Yes.
They've been doing it for a long time.
And then
and the San people have been doing it for 50,000 years. So it's really a South African thing that's just gone and come back.
That's right. Well, we're happy if it's helping relieve people of that debilitating and life suffering of migraines. And Dr. Elliot Shevel is the founder of the Headache Clinic. He operates here in Johannesburg. Thanks very much, Doc, for talking to us.
Thank you so much for having me on your show.
And we appreciate. And we hope that this little chat that we had with the doctor helps you understand what causes headaches and what you can do about them. He's got those unique methods that he's mentioned. So if you are a sufferer, pay me a visit and tell us how it went. And would like to hear your story on the program.